It's really great to be here. It's an honor and a pleasure. I really appreciate it. I do have some written remarks, and if you're interested, you can go to occ.gov to check those out. But for today, I thought I'd just talk to you. That's feedback for future speeches there. And I really want to start with a saying which is very familiar to everybody: what gets measured gets done. And if you go online, the origins of that statement are a bit in dispute. I think most people attribute it to Peter Drucker, the management guru, but there's an active online debate about whether it should be attributed to a French mathematician from the 16th century. We don't have to get into that here. I think it's important that in the fields of business and finance and banking, what's very clear is that what gets measured gets managed. We all know that, right? And it begs the question, in the consumer financial space, what is getting measured? So we could do this empirically. We could evaluate 10Ks, 10Qs, investor calls, public relations materials, on-site, or we could do what my kids claim that their friends do, which is to ask ChatGPT, what metrics do consumer-facing fintechs and banks focus on? Both consumer-facing fintechs and banks focus on a range of metrics to assess their performance, growth, and customer satisfaction. Let me just name a few. User growth and engagement, monthly active users, daily active users, user acquisition rate, user retention rate, transaction metrics, total transaction volume, number of transactions, average transaction value, revenue metrics, monthly recurring revenue, ARR, revenue growth rate, average revenue per user. Cost and efficiency metrics, customer acquisition cost, CAC, lifetime value, LTV, CAC to LTV ratio, operating expenses. Churn and retention metrics, churn rate, revenue, net revenue retention, customer satisfaction, net promoter score, customer satisfaction score, market share, competitive positioning, et cetera. Nowhere in this is financial health. Like, where is the consumer? Where is the person that this is all intended to help? Is Jen? Where's Jen? Tesher. Okay. Hi, Jen. So a couple years ago, Jen invited me to speak to the Emerge conference in Los Angeles, which was a really fantastic event, a great honor. And at that event, I spoke about this idea of financial health vital signs. And the analogy I gave was, my father's a doctor, and when I was growing up, as a teenager in Ohio, I would get into all sorts of trouble, and he'd have to bring out his doctor bag from time to time. Either I got sick, or I got hurt, or I had asthma, whatever it was. And he would pull out a number of things. First, a stethoscope. What was my heart rate? Second, take my temperature, thermometer. Third, take my blood pressure. Fourth, check my breathing. Those four things. And with those four things, he could diagnose, do we need to go to the hospital? Can I just sleep it off? Medication, what course of action should be taken from there? And those vital signs, if you break that down, it's interesting. What's key about these vital signs? It's simple. There's only four of them. It's objective. These are objective metrics. Anyone who administered that would come up with the same measures, right? It's administratable. You don't have to have a PhD. You don't need a fancy computer. You don't need Wi-Fi. You can just do it. And fourth, it's accurate. It's not precise. It can't tell you exactly what's wrong with someone, but it's accurate because it can tell the person administering it what course of action has to be done. So then the challenge was, can we come up with vital signs for consumers, for individuals? Now, the Financial Health Network and others have been working on this for a really, really long time, right? Amazing work in terms of trying to measure the financial health of individuals and communities. And the Financial Health Network report that comes out every year, it's a fantastic report, great insights in there. And it's based on annual surveys. That's really useful. I think the question is, can we complement that with vital signs that can be implemented on a more granular basis, on an individual basis, easily and quickly in real time? That's the challenge. So after that conference, I turned to my team and I said, team, let's give it a shot. And so team. It's led by Gravetta Gardenier, Barry Whitus, but really the heavy lifting is being done by Chandni Ori, who's here somewhere, and Louisa Quitman, and their teams. They're amazing. And what did they do? They do what we do at the OCC. First, we do our homework. Lots and lots of research, right? We dive into the research, roll up our sleeves. What is the latest and greatest on financial health? And what the attributes are, how to think about it. Engagement, lots of engagement. We talk to a whole range of stakeholders, consumer advocates, banks, fintechs, others. Like, how are you thinking about this? How do we try to operationalize this idea of vital signs? And then, of course, with the banks, data. We need data. Like, let's stop talking about the conceptual. Can we drive this to something that's practical, of practical use? All of that is now synthesized in a report that we're releasing later on today. And this report is, it's part of a series we called Community Development Insights. And I think we have a graphic or something on it with a QR code. There we go. And it's really trying to synthesize the research and the engagement that we've done on financial health and vital signs. I encourage everyone, there's a QR code, take a picture of that, download it. You can go to occ.gov, it's available there. And I don't want to steal the thunder of it, but I do want to hit a couple highlights. And the first is that in terms of the components of financial health, like we're just kind of pulling all the research, trying to simplify it, again, try to keep it simple, easy, intuitive, stability, resilience, and security. I think we all know that. We all know in our own personal lives, if we're having challenges with meeting daily financial obligations, that is stressful. That is stressful to our finances, it's stressful to our mental health. Same thing for resilience. I think one of the questions that gets asked often is, how much do you have to withstand a medical emergency, a car breaking down, a child that needs to go to the hospital, et cetera? Like that, again, that can create financial stress as well as physical stress. And then security, feeling secure about the future. So those are the kind of the main attributes that we really want to try to speak to and capture and observe. The question is, how do we do that? With metrics. Metrics. And I go back to, with vital signs, it's got to be simple, like not 1,000 metrics, a handful, right? Here we propose, we identify 3 as a starting point. Positive cash flow, liquidity buffer, on-time payments, or a prime credit score. Why those 3? Well, we're starting there because we want to keep this both practical and we need a starting point. There's this saying, 1,000-mile journey starts with 1 step. So this is a step. We're not at the end of the journey, this is the beginning. And we start here because consumer banks have this information. We can start doing something with this now. We don't have to build something, we don't have to build towards something. Look, 1033 is really going to help. When 1033 is fully enforced and consumers can permission their data across a bunch of different platforms in a particular way, that's going to open up and broaden the scope of data and information that can be used. But that's in the future. What can we do right now? And so these 3 metrics are a starting point for this conversation in terms of vital signs. Now, yesterday, Jen gave these remarks, which are really, to me, very inspiring. And 2 things really jumped out to me that she emphasized: trust and standards. And I think these are really, really critical. Trust. No matter how good the technology is, no matter how good the data is, if people don't trust what we're doing, they're not going to use it. It doesn't matter. That trust has to be built into what we are doing. And I think part of what this project is to try to come up with measurements that can earn that trust. It has to be about them. It's about putting the consumer and the individual at the center of the analysis. And I think this is part of that effort. It's on the trust side. Standards. How do we get there? Well, if we're going to have a measurement, we need to have standards for that measurement. There's this interesting, historically, one of the first standards that was ever developed was the kilogram. And it was developed in France, in revolutionary France, during the French Revolution. And the context was that people were buying bread, and the bread makers were, over time, using less and less flour in the bread to save money for themselves. And people over time found out, and it enraged them. They protested, they rioted. It got to such a point where the French government had to step in and address the situation. And how did they do that? They created a standard, the kilogram. And that standard weight could be used to say, yes, this baker is giving you a fair amount of flour in this loaf of bread that you are paying for. That's really critical. Now, there's an interesting side story to this. This kilogram, it's an actual object. And I think there's like 6 of them in the world, and one of them is in Maryland, like deep in the basement somewhere. Just go Google it. It's actually quite interesting. But these standards are really, really critical. And when you go from that example with the kilogram, you go all the way towards, now we've got standard setting organizations like ISO and others. And I think there's this great book called Engineering Rules. Talks about, if you're a nerd about this stuff, talks about the history of standard setting. And what's interesting about ISO, in addition to the process and the kind of how it's structured, the culture of it is really interesting. Because the culture of it is all of these folks get together, and they're not interested, they don't have a commercial interest, they don't have a political interest, they have a technical interest. Their interest is, as technicians, what is the right standard so that, given the material, electronics, whatever it is, so people can use it safely. That's the objective. And I think that this group here, those who are engaged on this project, this is what we need to do. This is our project, is can we come up with a metric, a set of metrics for vital signs for financial health that's objective, that's easy to administer, that's simple, and that's accurate. And this last part is where we need help. Like these vital signs that are been identified, are they going to work? We need help. We need everyone to help us to figure out, like, are these going to work? Are they accurate or not? And if they're not, what's better? What's a better mousetrap? I'm always interested in ideas, and if there's a way to do it better, we will ruthlessly steal that and use that for the greater good. I say that jokingly, of course. All credit will go where it's due. But that's the project. There's this. I'll leave you with one last saying. There's a saying of faster alone, farther together. And I use this in a lot of different contexts because the instinct, the tendency, is just say, I've got an idea, let's just go. And sometimes that's the right way to do it. But for projects like this, I'm a stronger believer that the more collaboration, the better. It'll get us to a better outcome. It'll be sustainable, it'll have buy-in, and it'll earn that trust that's so critical in this particular space. Thank you very much.